Thank you all for attending this talk. I'm Karthik Bhat, and today Hannah Tam and I will be co-presenting our paper titled Learning to Navigate Health Taboos Through Online Safe Spaces. This was work done at Georgia Tech with Priyanka Mohindra and advised by Dr. Neha Kumar. So prior work in HCI has increasingly been looking into the social cultural determinants of health, looking into how, for example, taboos, stigma, and gender affect the access to quality healthcare. These determinants are typically interconnected, as taboos and stigma have been particularly found to surround topics around gendered health and well-being. Our research community has explored different ways of addressing these issues and sought to identify ways in which technologies could be designed for or leveraged towards doing so. They have considered approaches like online resources for education around menstrual and reproductive health in schools, understanding social media affordances for self-disclosure and information seeking, and so on. One particular approach that we build on in our work is around safe spaces. Safe spaces as a concept have a history spanning decades and primarily look into creating safety within physical spaces to allow for protection from stigmatization and persecution, and for the creation of solidarity and community through self-disclosure. The idea of safe spaces has picked up more recently through the plethora of social media and networking technologies that permeate society today. Our research looks into such online safe spaces, given that the power and reach of the internet has, to some extent, reduced barriers to access, and we shift attention towards the potential learning that takes place within such spaces and how that could help overcome taboos around certain health topics. So in that regard, we asked, how might we design and scaffold online safe spaces to foster social learning around taboo health topics?
And so towards this research question, we partnered with a partner health organization, which will be called a research partner from now on. And they've been working towards health and wellness solutions for Indian women since 2019. And our research partner already had 2 existing online communities on Facebook, and as well as on Instagram, where they sought to share content and build community around stigmatized health topics. And so we recruited members from our study through a survey sent to these channels. After recruiting, we created and moderated a WhatsApp community of 35 members consisting of women and gender minorities. And we chose WhatsApp specifically given the platform's widespread adoption among Indian people, as well as the fact that we wanted to make sure we were creating a space where members felt comfortable to ask questions and talk about taboo topics in everyday language. Once we were done setting up the WhatsApp group, we shared discussion prompts at regular intervals in the group to facilitate discussion. And these prompts were centered around widely considered taboo topics in the Indian cultural context, including fitness and technology, mental health, abusive relationships, diets and skincare, body image, menstruation, and sexual wellness. Participants were also encouraged to talk about any topic of their choice, even outside of the ones that were covered in the prompts. We ran our study for 2 weeks, and at the end of the study, we conducted semi-structured interviews with 10 of the members, making sure we interviewed those who were actively engaging on conversations on the group, as well as those who had less engagement. The interview focused on different aspects of the community, with questions around online safe spaces in general, comfort levels around sharing and consuming information on the group, and cultural taboos relating to personal backgrounds and experiences. We also interviewed one of the co-founders of our research partner. Then, to analyze the learnings about taboo topics that took place in the WhatsApp group, we used the framework of legitimate peripheral participation, or LPP, and using LPP as a lens allowed us to better understand situated learning practices, building on Kumar and colleagues' proposal of framing challenges regarding taboo health contexts as learning problems and not only access problems. Moving on to our findings, we found that the WhatsApp group allowed members to leverage new audiences and support systems as they shared their experiences with taboo health topics with one another from their everyday lives. Not having family members and close contacts in the group allowed for members to express and reflect on how cultural taboos hindered open communication with friends and even existing family and even existing friends. P9 described this saying, there is a need for community outside of family because family fails to be the community. As members couldn't talk about these conversations elsewhere, members were also motivated to make the WhatsApp group a place where communication was prioritized and valued. P1 also admitted, I don't talk about these kind of things with most people in my life, so it was nice to have this place. Ultimately, this community provided a new audience where members had the freedom as well as the ability to learn, to engage in conversations on taboo health topics. Across interviews, participants also often cited anonymity among group members as a key reason behind why they felt like they could communicate honestly about taboo topics. However, participants weren't truly anonymous, as members could often see pieces of personal information about other members, like profile photo or phone number, and some even shared full names, their city of residence, and clearly identifiable photos at times to fully empathize with the group. But many participants still considered themselves as effectively anonymous, suggesting that being identified seemed to be less of a concern to members as long as they knew that the group didn't consist of family or friends. P7 touched on this when they said, family in this platform, I think that is terrifying for me. I think when you're in a group of strangers, you're a little more freer compared to when you're in a group with known people because you don't really care, right? Whether they judge you or not. We also found that the WhatsApp community became a space to break taboos around certain topics by encouraging direct engagement with them, meaning participants went so far as to not just talk about taboos, but they also began to unpack the origins of taboos and recognized who upholds taboos. Members even discussed gender roles, sexism, and the caste system in India, which also intersect in the ways that they stigmatized gendered health and well-being. For example, when one member shared about the emotional abuse that they had experienced growing up and the challenges it took to unlearn the internalized hate that they had towards their own body, another member responded and was really supportive and said, I'm sorry that you're going through this. It's okay to recognize your parents' toxic behavior. It doesn't make you ungrateful or a bad person. Anyone can be toxic and manipulative, even parents and doctors. I'm glad you have a supportive friend group. By encouraging direct engagement with taboos, the WhatsApp group helped members learn to navigate these cultural rules outside of the safe space as well. The last finding we wanted to highlight is around learning and how the WhatsApp group gave space for participants to internalize strategies to engage with taboos and socially construct a shared community knowledge. Our interviews revealed that some participants were exposed to completely new topics in the group, which contributed to that community knowledge based on conversations that either they directly participated in or just peripherally read. P5 said, a lot of times I had no idea about such issues. Now I'm understanding from a very good point of view, a lot of these women have taken therapy. So they share their experience of, whatever they were feeling was valid, like how their therapy sessions have actually helped them. Overall, participants learned various ways to process their emotions by reading multiple perspectives of how the other members responded to navigating taboos, which made space for both active participants and peripheral lurkers to create learning moments from the thoughts, opinions, and responses that resonated most with them.
So finally, coming to some of the key takeaways from our study. First, our LPP-based analysis allowed us to unpack how community spaces for discussing taboo topics can serve as social learning environments. It also brought to light the various explicit and implicit scaffolding mechanisms at play that can encourage healthy and meaningful engagement with taboo topics. In our study, these included group solidarity, both within the group and among individuals that encourage self-disclosure and breaking the ice around taboo, and also how these interactions could go beyond solidarity and disclosure and into reflection and questioning the status quo around health taboos. These insights extend the research by Kumar and colleagues who had proposed framing taboo health as learning problems as opposed to access problems. And finally, we learned that partial anonymity played a key role in self-disclosure and engagement on the group, given the social and cultural norms surrounding these taboo topics. Using platforms like WhatsApp that are widespread and having only a phone number shared afforded an ability to connect with others while maintaining control over the amount of personal information one would want to share with others in such safe spaces. We think this is a promising direction for future research on the design of social learning environments. So thank you all for attending this talk, and please feel free to reach out to Hannah or me for questions, either now or after the talk or during the conference. And hopefully you get a chance to read our paper.